All right, September is PCOS Awareness Month. PCOS, or polycystic ovary syndrome, is a hormonal disorder, and people with it often see a number of health problems, including diabetes, infertility. Here to explain more about women's health is OBGYN at UTHealth Houston, Dr. Keith Riggs. Thanks for coming in this morning.
Thank you for having me.
So, PCOS, pretty common, right?
Yeah.
What do people need to know about it? Or, I think sometimes when something is so common, it often gets very dismissed as not a problem, but it can be, right?
Yeah. So it is very common, that's true. And part of the problem too is that there's still a lot of disagreement on what really is PCOS or not. Different people, different organizations will say this is this or this is that. But basically, it's a condition, an endocrine problem where there's an excess amount of certain kinds of hormones in the body, and that can lead to things like insulin resistance, diabetes, high blood pressure. But it's also notable because the ovaries will form lots of small cysts on them, and that's kind of where the name polycystic ovary syndrome came from.
It's so complicated because sometimes women can have all the symptoms even without having the cysts on their ovaries. So it takes a doctor to a lot of questioning before you can figure out what this diagnosis is, right?
Yeah.
And why would it be important to figure out the diagnosis? Like, what are the complications that can arise from PCOS?
Yeah, so some of the complications, it's been associated with increased rates of diabetes, high blood pressure, high cholesterol. It can also be associated with certain kinds of cancer, like endometrial cancer. But one of the more common complaints that people come into my office with is irregular periods. And so that's usually what people first present to me with.
I went to a conference last week about cardiovascular disease, and they were talking about how, this is such a huge problem, people suffering with PCOS, and then it puts all of these women at risk for cardiovascular disease too.
Yeah.
So it's important, really, to get a diagnosis as early as possible and inform these women of their risks and really what they could do about it, right?
Absolutely, yeah. And so when you first come into the office, we'll do the full history. We might do a physical exam, and then a lot of the diagnosis is made based off of lab work and ultrasounds as well, looking at the uterus and the ovaries. And so it kind of takes a full workup to really make, to make that diagnosis.
And then what would you do to treat it?
So that kind of depends on a lot of kind of what other symptoms you have with it. So some people will have a lot of excessive signs of excess testosterone. So they may have hair growth, they may even have male pattern baldness. And so we would treat that with certain types of hormone blockers, depending on what certain things. We may give them medicines for that, but actually the mainstay of treatment for PCOS is typically actually weight loss, because it has been associated with certain metabolic conditions that, especially for women dealing with fertility or women who are overweight or obese, losing up to 5% of their body weight can drastically increase their fertility rates, help them return their periods to normal, and help with a lot of the other symptoms that they have.
So that would be the treatment for PCOS. Otherwise, you're just kind of treating the symptoms of the PCOS?
Exactly.
Yeah, and at that conference that I was telling you about, they talked about how women with PCOS can suffer from weight gain, and a lot of times it's not from overeating, but it's from malnutrition. Do you find that too?
Yeah, and so it is very complicated because we think of of overeating as a lot of the problem, but a lot of it has to do with our endocrine system, our metabolism, and what we eat is also very important as well.
Yeah, to feed those hormones, make the hormones happy.
Exactly.
Talk about how PCOS impacts fertility.
So one of the main issues, and this is probably, if it's not for irregular periods, it's for fertility problems. And those are the reasons why people typically come to my office that end up with a diagnosis of PCOS, because it causes irregular periods. And then when the periods are irregular, that can affect your fertility, causes problems with ovulation. And so a lot of the time we do kind of a full workup, find out, oh, it's PCOS. And then the treatment, depending on what your fertility options are, what your plans are, then that will kind of inform what treatment we recommend.
We were showing video a second ago of a woman, keeling over. Does it cause pain and discomfort? Do women ever experience that as a symptom?
So sometimes, yeah, it can cause, lots of cysts to grow on the ovaries. And the ovaries normally make small cysts every month just as part of their normal process. But we find that with PCOS, it's an excessive amount of cysts. And like, a lot of people know, if those cysts get really big, then it can cause a lot of pain. It can cause, the ovaries to twist. It can cause a lot of severe problems later on.
We talked a lot about, it's important to diagnose women early so that they can be in control of these other things that they could be at risk for. But who is at risk for PCOS?
So it is typically associated, like I said, women who have issues with diabetes, high blood pressure, there's some sort of connection there. And still, as a science, we still don't really know what causes PCOS. We haven't found any gene or set of genes that tells us what that can, confer a risk. There isn't anything in the environment that we know of that causes it, but it has been associated with things with insulin resistance or diabetes, high blood pressure. And so trying to make all the healthy choices that you would make to avoid those things should also help with PCOS prevention.
There's lots of studies looking at how this can be passed down from even a father who may have had diabetes or something like that and can pass it on to a daughter. So it's not always, your mother had this, so you're going to have this, right?
Yeah, it's not always clear cut. And, there's still a lot of debate on, what causes it and what the diagnosis, how to make the diagnosis of PCOS.
Yeah.
And so, but a lot of those things like diabetes does have, you can pass along that susceptibility to your children. And so that is something that, if you have those risk factors, if you're a high risk for diabetes or other metabolic problems, then definitely it's something that you should try to address early on, with your doctor before it becomes a problem.
All right, Dr. Keith Riggs, thank you so much for joining me. A very good topic that impacts a lot of women, so we appreciate you coming in this morning.
Thank you so much.